Welcome to the Nursing School Chronicles. Today we'll be sharing our journey and growing into the nursing role, learning from our mentors, embracing challenges, and shaping the nurses we hope to become. We're all nursing students, seniors, and I'm John.
I'm Kendall.
I'm Cameron.
Okay, so today we're going to be talking about how we see ourselves, the best nurses we've had, the best advice we've given, things like that. So, Kendall, we'll start with you. What's some of the best advice you've been given from your mentors, professors, and how has it impacted you?
I think the best advice that I've been given as far as like studying or like keeping up with schoolwork is always doing those dynamic quizzes and just using the quiz bank and stuff like that. It like really helps you whenever you're taking tests and breaking down the question, I feel like. So that's the best advice I've been given. It's really helped me in test taking and stuff like that.
And how's that shaped like your nursing philosophy, and do you have any stories to go with that?
I don't know. I think it shaped me in a way where I now more understand what's more important. Like obviously schoolwork's important and all that stuff, but like the end goal is passing the NCLEX. So practicing those questions will really help you develop a better way to break down questions and to figure out what they're asking you and which one's the right answer. So that's how it shaped me in figuring out like what I need to prioritize more. And then what was the second question? I'm sorry.
Do you have any like personal stories about it or anything like that?
I think my only story is like staying up late and trying to do my 10 questions. That's pretty much it. Or like, yeah, I think that's it. Just staying up really late, trying to do those 10 questions, trying to figure out like, or whenever I get them right, I feel like really proud because sometimes I won't know what it's asking and I'm just like, I think it's this, and then I answer and it's right. So I'm like, oh, like it works.
How about you, Cam?
My best advice would probably be like, remember your why. So like no matter if it's like a hard exam and you feel like you don't know anything or heart cynical, like always going back to like why you chose nursing, like why you want to be a nurse. I think that's probably the best advice I've been given.
Yeah. For me, it's to trust your instincts and like don't second guess your answers on exams. This really helped me be confident going into the exams and really sped up my exam taking as well. Just being able to, you know what you know and you don't know what you don't know, and you go through it. You're confident in it, and it also helps to take care of patients without second guessing yourself. You know, I've done this before. It's going to be okay. Go do it again.
Yeah.
So next we're going to talk about your ideal nurse. So Kendall, how would you describe your ideal nurse?
I know when I know it's not the same, but when you go to like urgent care, they're very like get you in and out. But like my ideal, what I want to be when I become a nurse is I want to really take care of my patients, make them feel safe, make them feel confident in what's happening to them, because I know that whenever I was going to the doctor and stuff, I was very confused. I left with so many questions, and I just want to be that nurse where I answer all their questions and make them feel like they can talk to me and ask me without being embarrassed or I don't know. But yeah, that's the type of nurse I want to be.
How about you, Cam?
I would say like probably like compassionate, honest, like patient-centered, like not even just for the patient, but for their family as well. Like making sure the patient's comfortable, but also making sure the family's comfortable too. Because I feel like that's a big part, and also healing for the patient is knowing the family's taken care of.
Yep. I think for me, it's back to the confidence. I think nurses should be confident and knowledgeable in what they have, and that helps them to advocate appropriately along with empathy to be able to put yourself in that situation. I've tried to embody these things so I can advocate, but seeing my nurses be confident in their skills helps calm me, helps calm the patient, and we all know that this is the best care we can provide because no one is worried going in there.
Yeah. And a calm nurse makes you feel calm.
Yeah.
Yes, I try to be that calming presence. Yeah. But a lot of that is not how you're feeling, but how you portray that feeling to your patients.
Yeah.
How about growth we've experienced so far in nursing school?
I think like what you're saying, like confidence, I've grown in my confidence because, I mean, throughout nursing school, you feel like, oh, I don't know what's going on. But I feel like now definitely, especially with doing homework and when I get the answers right, I'm like, oh, I do know what I'm doing, you know? Like, I'm not dumb. But sometimes we feel that way. But I feel like definitely your confidence grows throughout going to clinicals and completing assignments and all that. So,
But for sure, confidence, I think, like from like the first semester to now, not even just like clinicals, but even exams too. Like I can look at a question and I'll be like, oh, I'm absolutely don't know this. So like I can actually be like, okay, I can try to figure it out. So I definitely think confidence grows.
Yeah, I wasn't super confident going to nursing school. There was things I knew, but the skills I didn't know. And so compared to a year ago, I feel way more confident in all my skills. If a nurse asks me to do something, I can jump up and go do it.
Oh, yeah.
And I think that helps the patients too, because nothing's worse than having a nursing student in there who's shaking and you don't know.
yeah.
Stand in
So,
the corner.
yeah.
Yeah, definitely.
So it's helped to jump in, help triage patients, things like that.
Yeah. I think it also helped with my people skills.
Yes.
Because I was not a big talker. Now I can actually have a conversation with random people.
Oh,
Yeah. How do you feel about the lifelong learning aspect of becoming a nurse?
I think it's nerve-wracking knowing that I'm going to have to continue learning my whole life, but I'm ready for it. I feel like it's a part of healthcare, and I didn't really know that aspect of it until coming into nursing school, but now I do, and I think it's a very important part of nursing because technology and like our brains are growing, you know, like people are learning new things, so I think it's a important part.
Yeah, I would say the same. Like, I like learning, so I'm excited to do it, but it definitely was nerve-wracking knowing, like, a lot of things change in healthcare within 2 years. Like, everything can change. And so I think it's just, I don't know, I'm excited, but it is a little nerve-wracking too at that point.
Yeah, I understand. It is because you feel like you're not going to be confident in the skills as they change, but also being able to read those studies and keep up with it, I feel like it's going to help my confidence because I can know that I'm constantly refreshing my knowledge and staying up to date. But do you have any inspirational advice or anything like that?
But I don't know. I think believing in yourself, it sounds cliche, but it is. Like, you have to believe in yourself and know you can do it because, like Cameron said, like knowing the end goal, like why you came into nursing school and why you want to be a nurse, that's very important to keep in the back of your mind because sometimes you feel like quitting because you're like, oh, I feel too dumb, or I don't know if I can do this, I'm not smart enough and stuff like that. But I think definitely just remembering why you wanted to do this in the first place is important.
I would say just, like, remember your why when it's bad and also when it's good. So, like, when something good happens, be like, okay, this is exactly why I wanted to do this. Yeah. Not just when you fail an exam or someone yells at you or something like that. Like, always know, like, okay, always go back to that. Like, I think that's the important part to also keep you grounded and, like, confident in what you're trying to do.
Yeah, I think for me, it's the fact that, especially going into nursing school, you feel like you don't know anything. And it's okay to feel like you don't know anything, and that's why we're in school. But by practicing and just going over your skills, going with your nurse, and spending time with patients, you grow that confidence.
Yeah.
And you're going to become a more competent nurse, and it'll help calm down your patients as well.
And definitely ask questions too.
Yes. Yeah, but just being able to be in there with the nurse, it helps a lot. And I feel like I learned a lot more in clinicals than I did in the classroom because I was able to practice all those skills.
Mm-hmm.
It helps connect things.
Yeah, it starts clicking once you start seeing it in real life.
You'll do it and you're like, oh yeah, I read this like last week. It just helps a little bit more.
Yeah,
for sure.
Well, I think that's all we have for today. So thank you for joining us.
Thank you.
Right. House stuff.